So I wanted to ask you if there were any other key takeaways that you wanted to share.
I think my key takeaway is, this is still an evolving field. We are still figuring out where we can apply this most dependably for different purposes. Will this be complementary? Will this replace certain things? I think it will depend very much on the setting. I think it'll depend very much on the stakeholder, and I think it'll depend very much on the disease. And so there won't be a one-size-fits-all answer for real-world data and evidence. It will, like any clinical trial or clinical development program, it will have to be fit to purpose. It will not be a one-size-fits-all kind of answer. And I think that was clearly demonstrated on the call in terms of, where people might be more conservative about applying real-world evidence and where people might be more willing to jump in with both feet. And I think it really depends on what your clinical development plan looks like.
Yeah, and I think to build on that, Amy, I think that's a really important point. And to build on that, when we say that it's not a one-stop shop or a one-size-fits-all, I think that is a really key element because there are many different questions that we need to answer in order to develop new therapies effectively, and we have to look to the best source for the answers to those questions. And I think what we're seeing today is a growing recognition that there isn't one best source for all answers, for all questions, and that we do have to look in a very targeted way to be able to do that. And in doing so, we can really optimize, I think, personalized medicine, and we can be more targeted and specific in the way that we're answering those questions. So I think what I saw today was a real recognition and acknowledgement of the fact that yes, there are many different things that we have to address as we're developing these therapies, and RWE is one of the tools that can help answer those questions.
Maybe to add quickly, I fully agree with what Leanne and Amy said. I think to me, it became clear how widely this is being used, real world evidence and real world data. And to Leanne's point, we have to, as a solution provider, have to think about real world data and real world evidence as an option to answer some of the key research questions. If you don't, you're going to be left behind, because this is certainly the path that the industry is on.
Yeah, I know. I think that's where I left really energized about the discussion, because we were really focused more on expanding the use of real world evidence across all types of different value triggers. So I thought that was definitely exciting. And I think identifying those value elements and connecting them back to the patient would really be something that will resonate both with our sponsors, but also with our own organization.